contest a little bit later on. I want to go to the Jersey Central Newsmaker hotline. This year marks a rather important anniversary. It is the 35th anniversary of the first reported cases of HIV and AIDS in the United States. And how far have we come in the 35 years since then? Let's welcome in our special guest for a couple minutes to talk about this. She is the Chief Executive Officer, Gay Men's Health Crisis, and we have Kelsey Louie, who's with us here this morning on WCTC. Hey, Kelsey, it's Burt Barron. How are you?
Good. How are you? Thanks for having me here.
Good to talk to you. My early recollections of HIV, I was a young teenager here in New Jersey back in the early 80s, and it seemed like the initial impression was this was limited to people maybe from Haiti or certain parts of the world, or maybe it was just limited to gay men. But we've learned some hard lessons over the years that this really impacts everybody and has for a long time.
Absolutely. HIV is an epidemic that affects all people and doesn't discriminate. And it's really about what you do rather than who you are in terms of who gets infected.
Exactly. What is HIV, the long view, and what's this all about?
Well, HIV, the long view, is a forward-looking report that takes into account future healthcare trends in order to discuss what we should be doing today around HIV prevention and care.
Do you feel that with the progress is where it needs to be, Kelsey? I mean, obviously, you'd like to see nobody die from this or no one even contract this. But in the 35 years, are we winning this fight?
We are making good progress against HIV and AIDS, and which is why this, although there's still a lot to do, which is why this report is so important. We still have 50,000 new infections each year across the country. However, it's impacting different populations in different ways. For example, young gay men of color are disproportionately impacted by HIV and AIDS. So this report, one of the things that this report does is takes into account that we need very specific and tailored interventions for different groups of people.
When you look at the case of, you think of some famous people, you think of Arthur Ashe, you think of Magic Johnson, both of whom contracted this very differently. When you look at Magic Johnson, is he more the rule nowadays, Kelsey, or is he the exception for someone who has this virus?
I would say unfortunately, there are no rules or exceptions with HIV and AIDS. As I said earlier, HIV does not discriminate, which is why, again, this report is so important because it's bringing awareness that HIV is something that can impact anybody.
And continues to 35 years later, still to this day. Other countries around the world deal with it on the level that we do, Kelsey, here in the U.S.?
Oh, absolutely. HIV is impacting all countries around the world. And in those countries where access to health care or access to medications are limited, it poses a bigger problem. And again, this is one of the things that this report talks about is the need for improved access to health care, to quality health care.
And speaking of healthcare, I'm glad you mentioned that. Is this something that people should still talk to their doctors regularly about, Kelsey, and just make sure that everybody has the most current, most up-to-date information?
100%. This report, one of the things that this report does is talk about the need for people to have some very specific and careful conversations with their doctors. We want to eradicate stigma related to HIV and AIDS. As we know, HIV and AIDS thrives in the shadows of shame and stigma. And one of the things that shame and stigma does is it prevents people from talking about it, even to their healthcare provider. So it's so important that people have these conversations, especially with their doctor.
Yeah, and I think, I don't know, maybe we just got, and maybe you see this too, Kelsey, in the time that you've been in the position that you're in. I don't know, maybe people just get complacent after a while, and they just think, well, this can be treated or whatever. It's not in the news as much as it used to be, so maybe it's going away. And I think you have to have a completely different mindset about this, and this is something that you need to make educated decisions on.
Absolutely, and with the medications that we have, it's great that it is now considered a chronic condition. However, especially the younger generations, they're not aware of that period of time where HIV and AIDS decimated an entire community. And so it's important that one of the things that this report does is it reminds people of the importance of talking about HIV. It reminds people about the importance of HIV in terms of long-term health care, and it just reignites the conversation around HIV, especially for young people.
Yeah, and I think it's important to keep that conversation going. You know, social media plays a role in reaching a younger audience and a younger consumer. So I think that social media really has kind of played a role in this and just kind of getting the word out about this. And like you said, that there's a generation of people that, I mean, forget about saying that they were born, with microwave ovens were always around in their lifetimes. You look at that. But getting the word out about this, obviously much more important, I think, is critical, the role that social media plays in this.
Absolutely. And another thing that this report says is that we should not have a one-size-fits-all approach to HIV care and prevention. So you bring up a good point. Social media is one really effective way to get to a number of people, especially that younger population that we've spoken about.
Is this report available to be downloaded and viewed by the public, Kelsey, the HIV, the long view? Is this available for public consumption?
Absolutely. You should go to hivthelongview.com to read the entire report.
Excellent. Well, thank you for your time this morning. Kelsey Getty, the CEO of the Gay Men's Health Crisis, thank you for your time this morning. And it's hard to believe 35 years have gone by since the first case, but I feel good about the future, and I certainly hope you do as well.
Yes, I do. Thank you so much.
All right, thank you. All right, Kelsey Louie, my guest on the Jersey